everybody was going to get Naloxone kit.
Reached down, saw it, picked it up, put it in his mouth. What is Naloxone and why should you have it? Hi everyone, welcome to RX Unscripted with Jen and Shelley. This is our first episode. I have a Naloxone kit and I'm not afraid to use it. Do you? I'm Jen. I'm a pharmacist and a mom, and in my day job, I own a community pharmacy in Amherst View, Ontario, just outside of Kingston.
And I'm Shelley, and I'm a pharmacist and also a mom, and in my day job, I support pharmacists like Jen take care of patients.
So it's December. We're in the middle of a pandemic. It's been quite the roller coaster year. Why are we sitting here today talking about Naloxone in the middle of a pandemic?
Yeah, Jen, great question. And what reminded me was that I was standing outside with a mom friend of mine just a few weeks ago, and she was saying, I've never really thought about my Naloxone kit in a long time since I got it. Is there anything that I should be thinking about? And I was thinking, I remember when she got it. It was 3 years ago, and it's probably expired by now. We had a girl in our neighborhood who went to high school with my daughter who died of an apparent drug overdose. She had bought some counterfeit Percocets from somebody at school, and they were actually laced with fentanyl. And unfortunately, she passed away, and there was a dad in the community as well who wrote an open letter about his daughter who had challenges with substance use disorder. And so it was really the talk of the town and the talk of the neighborhood. Everybody was going to get Naloxone kits. Pharmacies had just started to stock them. And now we've had this crazy year and we're not thinking about it. Life gets busy. So I thought it would be a good chance for us to chat about that a bit today.
Absolutely. So flash forward to today. We're in the middle of a pandemic. Life has been more complicated and challenging than it ever has before. And we know that opioid overdoses aren't going away. In fact, they've been increasing. 40 to 50 people in Ontario alone per week are dying of overdoses. So this is a really important topic to be talking about, especially as we go into a holiday season where people may be struggling more with their mental health. They may be getting together, there may be partying going on, and ultimately when we're looking at a society that's struggling with an opioid overdose in the middle of a pandemic, so essentially a crisis within a crisis, this is a topic that we can talk about because this is one way to save lives. So when I think about Naloxone, the first story that comes to mind for me was actually right around when I started practicing as a pharmacist several years ago, and it was in my first job as a community pharmacist. And a young mom, a patient of mine, had her toddler have a very scary scenario involving an opioid. So mom herself, no one in her household used opioids, but she had a friend over who did. And ultimately, that friend brought their medication with them. We don't always know when people bring medication to our houses. They may need it while they're visiting. It's often something that is in someone's purse or is used in someone else's home. And that friend, unfortunately, dropped one of their capsules of hydromorphicon while she was over at her house. And it ended up, I think, being swept into a closet somewhere and being unnoticed for a number of days. And the family had a cat. And anyone who knows hydromorphicon capsules knows that they kind of jingle. They've got a little bit of a rattle to them, so they make a noise. They're brightly colored. So the cat started batting that capsule around in its paws and actually knocked it out into the open, into the living room, where the mom's toddler reached down, saw it, picked it up, put it in his mouth. She saw him put it in his mouth, and she knew he shouldn't have anything that was going in his mouth at that point in time. He wasn't snacking. So she did run over, she did a mouth sweep, and found that the toddler had actually already bitten down into the capsule. It had opened, and the medication granules inside had already entered his mouth. So we'll talk more about that later. I will let you know what happened. But I think this really kicks off the question, or the talk of why Naloxone is important. And so, Shelley, can you tell us what is Naloxone and why should you have it?
Yeah, thanks, Jen, for sharing that really heartbreaking story. Naloxone is a drug. It's very safe. It's an effective drug that works quickly, but temporarily to reverse the effects of opioids. So what are opioids? So you mentioned a couple of drug names. I mentioned fentanyl, things like Tylenol number 3, even heroin is an opioid. And Naloxone is used in the cases of potential overdose to reverse the effects. Doesn't permanently do it, it temporarily does it. And so I mentioned overdose, Jen. So talk to us a little bit about the signs of overdose.
Yeah, so it's important to know what the signs of overdose are because they're not all specific to overdose. Other things could cause some of those signs and symptoms. So knowing about it helps you identify when this may in fact be a drug overdose. So oftentimes people will appear either very drowsy or even fully unconscious. They may be having trouble speaking, they may be slurring their words, they may appear sort of like they're drunk in that sense, have trouble walking. They may also be breathing very shallowly or even not be breathing at all. And that's one of the most important things to recognize is that an opioid overdose will actually stop your body from breathing on its own, and that's how people die. So it's definitely something to look out for if you're looking for the signs of an overdose. If you're able to see the person's eyes, they may have very small pinpoint-like pupils. So the black part of their eye may be very, very small, or their eyes may be rolled back into the back of their head. Their skin may be slightly blue and cold to the touch. They may be fully unconscious or be making some sounds like gurgling or snoring. So now that you've recognized an overdose and you're thinking about giving a drug like naloxone, as you've mentioned, that temporarily reverses an overdose, if someone isn't overdosing, is this medication safe?
Yeah, Jen, that's a perfect example with the story of the toddler that you just shared. And yes, I mean, the short answer is absolutely. Naloxone is safe in babies, it's safe in toddlers, it's safe in kids, and kids sometimes get tempted. If there's prescription medication in the house that isn't locked up safely, it's important to think about having naloxone, then it's safe to give it to them.
And I'm remembering back to when I was pregnant a few short years ago, and I was actually prescribed an opioid at one point in my pregnancy. If I needed naloxone, would it have been safe for me while I was pregnant with my son?
Yeah, absolutely. Great one. And safe for you, Jen, not only you, but safe for the baby that's inside you. So potentially saving 2 lives there. So Jen, we've talked a little bit about naloxone, some of the basics now. So tell us who should actually get a naloxone kit.
If I had to give a short answer to this question, it would be anyone who is willing and able to save a life and help someone experiencing an overdose. Ultimately, anyone can get a naloxone kit. So, but there are some people that it may be more important that they have access to one. So people where they themselves or someone in their family uses an opioid medication, be it prescription or for recreational use. So those could include people who take very high doses of opioids, those who have recently switched to a different type of opioid, or even someone who's had their dose changed recently. All might be more at risk of something like an overdose, unintentional in often cases, but it'd be important for in those cases to ensure that you have a naloxone kit in the home. It's also important for anyone who uses or knows someone who uses opioids recreationally and illicitly. Ultimately, if they have had an overdose in the past, even more crucial to ensure that you have naloxone kits on hand in order to help in those situations. So with naloxone, if I'm going into a pharmacy, am I getting it for myself or can I get it for myself?
Absolutely. I mean, you might get it for yourself. You might get it for somebody that you live with. You might get it for a friend. Yes, I think it's an important thing to think about, particularly if you're on prescription opioids or you're using recreational drugs. It's something that it's important to have in the house. If you are using recreationally, you should never use alone. We talk about that a lot. And so it's really important for others who are around you to be able to give you the naloxone, to recognize the signs of overdose and not to give it to yourself. So Jen, this is a question that I've certainly been asked by people. How do you actually, I think people stumble on this, right? Like, how do you actually go and get this naloxone? Do you just call up a pharmacy and say, do you have naloxone? Do you walk into the pharmacy and go to the back and ask for naloxone? What do you do?
Yeah, it actually really is that easy. You can go into any community pharmacy and ask to speak with the pharmacist about getting a naloxone kit. And that pharmacist will provide you not only with the kit, but all of the information and education you need in order to feel comfortable using it. You shouldn't feel uncomfortable, you shouldn't feel judged, you shouldn't feel like people are thinking that you're doing something wrong by coming in to get a naloxone kit. Because what this is telling someone that you are interested in helping someone who is experiencing an overdose and potentially saving their life. So as pharmacists, We are members of the community. These are our patients, our friends, our family, people in our communities that we want to see keep safe. So we will always be happy to talk to anyone and educate anyone on how to use a naloxone kit. So after you come into the pharmacy, are you getting just one kit or can you get more than one, Shelley?
You can get more than one, and you heard here first that feel comfortable talking to your pharmacist. And if you want to pick up 2 kits in a day, you can. Some people, for me, I've had someone say, could I have the injection and the nasal? And I've given both in the same day. So you can pick up 2 at a time. You can even come back the next day and pick up another kit. So don't feel that, well, I can only pick up 1, or I can only get 1 a month or 1 a year. It's not like that. You can pick up 2 in a day.
Now, we also talk often about avoiding telling people that you may have opioids in the house for your own safety and for the safety of others. Is that the same situation with naloxone? Should we avoid telling people that we have it in the house?
No, this is all about access. So if you've gotten naloxone from your pharmacy or maybe even from a local community center, it's important to talk to people that you live with. I talk to people in my neighborhood. I let them know I have a couple of kits in the house, where they are, how to use them, and think about getting people refreshed if they don't remember, and going back to see people like you to get a little bit of a refresher on. Can you just walk me through how to use this again?
Another really important question I think that we hear is, if I have to use a naloxone kit and I'm in a scenario where there are illegal things happening, if I call 911, will I get in trouble or will I get arrested just for having been there or having been involved, or will the person having the overdose be arrested?
Yeah, no, I guess I should say yes, no, you will not get in trouble. You will not get in trouble. And this is something that, as moms, we don't even think about this, right? We think of course I'm going to call 911. But my kids or their friends may think, if I'm at a party and there's, like you said, illicit drugs, recreational drugs being used, and I'm there, could I get arrested? No, there's something in Canada that protects you called the Good Samaritan Act. So you should always call 911. You will not get in trouble. You need to save a life if you're in that situation. So don't worry about that at all.
So good to know and reassuring that people should not hesitate to call 911, because as you mentioned before, naloxone is only temporary in how it reverses an overdose, so you do need emergency medical attention after administering naloxone in order to ensure that that person remains safe and healthy.
Yeah, thanks for bringing that up, Jen. That's really important. So, Jen, I know everybody wants to know what actually happened to that toddler that you were talking about earlier on when we started this conversation. Can you tell us what happened?
I can, and fortunately this is a good news story. This story had a happy ending where, despite needing to be admitted to the hospital and admitted to the pediatric ICU for several days, this toddler was okay. They were able to act in time. Emergency services was there in adequate time, and that baby turned up okay. Unfortunately, we do see some headlines in the news where that's not always the case with accidental ingestions in children. But in this case, even though her son was okay, mom was absolutely devastated. And I can only think, as the mom of a toddler myself, who puts everything in his mouth, where I would be mentally if that happened to my child, especially if I didn't have a naloxone kit to rapidly administer and ensure that I was doing everything I can to keep him safe in that instance. Because we know in this story, there was no way of her suspecting that she would need that kit, but she still needed it anyhow. So for me, that really hit home, and it changed the way I counseled my patients about having a naloxone kit.
Yeah, that's great. And I think as moms and pharmacists, when we think about our own experiences, it really does change the way how we talk to people. So I hope everyone is comfortable talking to their pharmacist. And so same thing for me when I circled back. I just went back and talked to that mom the other day, and thinking about this pandemic year that we've been in, there is another public health crisis going on, like you talked about earlier, Jen. There are lots of opioid overdoses happening all over the country, and so it is important to keep this at top of mind. And so I encourage that mom to go back to get a new kit. It's been expired for at least a year, to go get some refresher training, or even come and talk to me here at home. I'd be happy to walk the whole family through things. So thanks for reminding me.
So we've covered a lot of bases today when it comes to naloxone, and we're now at Jen and Shelley's top 3 takeaways. So Shelley, what would be your number 1 takeaway when it comes to naloxone?
So for me, takeaway number one is definitely we're in a pandemic. We know that opioid overdose continues to be on the rise. It's not difficult to overdose on an opioid like you talked about, Jen. So go to your pharmacy, go somewhere, get a naloxone kit and get it replaced regularly. Don't be embarrassed. It's a good thing to do and you should feel good about it.
So I would say my number two takeaway would be to let everyone know you have the kit and make sure that they know where to find it. Because ultimately, a fire extinguisher that you can't find isn't much use in a house fire. So similarly, when you're in an emergency like an opioid overdose, you want to know where the kit is to access quickly to help reverse that overdose.
Yeah, great, Jen. And tip number 3 is, like we talked about, always call 911. Naloxone can save lives, but it does that temporarily. It's a temporary Band-Aid, and you do need to call 911 to ensure that you carry this through and that person's life can get saved. You will not get in trouble. Make sure you're calling 911 when you have that naloxone kit and you're administering it.
If you want more information and resources on naloxone, what it is, how to use it, and where to get it, be sure to check the description below, where we've linked a lot of the resources we use to create this episode. If you have any questions, comments, or even ideas for future episodes, please reach out either in the comments below or by reaching out to us on social media. You can find us here on YouTube at RX Unscripted or on Facebook, Twitter, Instagram, and TikTok. Please click on the bell for notifications and make sure you subscribe to the channel so you don't miss out on any of our future episodes. Thanks so much for tuning in, and please stay safe.
Thanks for watching, everybody.